Garrett Blevins here today at the Point Loma Nazarene University Balboa Regional Center. I'm here with Dr. Nicole Cosby, the Director of Athletic Training, and as you know, Kristen Dunsmore. The goal today is to figure out exactly what happened to my hamstring and how long the recovery is going to be after my third deadlift at the meet, hopefully to get me healthy and ready to go for nationals this year in February. So what do we got planned today?
So today what we're going to do is we're going to take a look at your hamstring. We'll start with a patient history. The first thing that I like to do is really figure out if the patient has ever injured that limb or that leg before. So we'll start with a history dive. That'll allow me to get to know the patient a little bit better.
I didn't know I had to remember things about myself.
Yes, you do. That's part of, you have to do some of the job here. After we go through history, then what I'll do is I'll start to touch the patient, or in athletic training, we call that palpate the patient. That allows me to determine if any tissue structures are actually damaged. And then I'll move into what we call is manual muscle testing and special testing, which is where we get to test the actual integrity of the muscle. Those things, those key items, the history, the inspection, the palpation, and the special tests will really allow me to figure out what's wrong first and foremost. But then the question that every athlete wants to know is how long they'll actually be out for. So shall we begin?
Excellent. Sounds good.
So the first thing that I'm going to do is have the patient lay down in what we call is a prone position. So your face is going to go down into the hole of this table. And tell me which side is injured. Is it your right or your left? Okay, so patient's right side. One of the things we always do as clinicians is we actually want to I think of the patient's body as artwork. So we always want to start on the uninjured side first to figure out what it actually feels like. Then we'll move to the injured side of the patient. So what I'm going to do is lift up the patient's shorts, and patient, you're okay with me exposing most of your thigh and your leg?
You're all good.
Okay, and then what I'm going to do is tuck the patient's shorts just a little bit. We suspect that the patient has a high hamstring strain, and so what we know about the hamstrings is that they attach way up here on the pelvis. So we're going to expose the patient more than we normally would in a video setting. So I'm just going to touch.
Watch out, YouTube. Demonetized. Here we
So
go.
let me know if anything I do hurts, which it shouldn't because we're on the uninjured side. But as you guys can tell, the main thing that I'm trying to do is just figure out what the uninjured side feels like. And I'll do this systematically all the way through. And is there any pain that you're feeling?
No
okay,
pain.
Any uncomfortableness?
Not beyond the normal of being exposed on the World Wide Web.
Okay. So I'm going to put the pant leg down of the patient, and then what I'm going to do is actually kneel down next to the patient and work with the injured side. The key to being a good clinician is never starting where you know it actually hurts. Since the patient has expressed to me that he's having pain in this area, I'm going to start down here. And what I want you to do is on a scale of 1 to 10, as I get closer to the painful site, a 1 being very little pain, a 10 being the worst pain you've ever experienced, just let me know as I touch. So what's that feel like?
That's a 0.
Okay. What's
0
that?
Still. That's a 1 or so, yeah.
So a 1 or so. How about if I go here?
0.
And if I go here?
1.
Okay,
Pretty
compare it to this.
Equal.
Equal,
It's
perfect.
still pretty low. Oh, there's
That's the jackpot.
Like, yeah, there's
okay.
it's up to like 3 or 4 right there, even with just minimal pressure.
What about here?
It's tender, but not the pain. That's
This is
That's it right there.
Okay, and then if I go here?
Good.
Okay, YouTube, so many of us know the hamstring muscles, but for those of you who don't, let me tell you a little bit about them. The hamstring muscles have 3 muscles incorporated within this particular hamstring group. On the inside of his leg, we have what we call the semitendinosus and membranosus muscles. And on the outside of his leg, we have what's called the biceps femoris muscle. The biceps femoris muscle is typically the larger, more meatier muscle that you typically will strain if you have a hamstring strain. So right now his point of pain is right in the central portion of that biceps femoris muscle. So I'll keep going and you tell me if the pain gets worse, gets better, or stays the same as I move from this painful point. Okay. So describe your pain here.
That's higher there.
That's higher there. And then if I go here?
Not so much there.
Okay, and then what about here?
0.
Okay, so the most top part or proximal part or attachment for the hamstrings is a bony prominence right in here. So what I'm trying to do is just figure out if he's done what we call is avulse the muscle or pull the muscle away from the bone, which it doesn't look like he's done based on palpation. So this is okay?
No pain.
So I'm gonna go back to our most painful spot, which was here.
Right there.
And I'm just gonna sweep my hand up your hamstring. And what I'm feeling for here is any deformity, right? One of the key, most important clinical diagnoses when we're looking at hamstring strains in particular is whether or not we actually feel deformity within the actual integrity of the muscle belly. So I can feel nice, great muscular fibers here, but as I move more upward or proximal, I'm starting to feel a little bit of fluid. You can feel that by the fluid moving around across my fingers. And then I'm also starting to feel a little bit of a muscular defect right in this area, which tells me that we think about strains, there's like 3 different grades, right? Strain 1 is like here, the muscle fibers are together. Strain 2 is where the muscle fibers start to come apart. And a strain 3 would be like a complete rupturing. So what we're feeling here is probably more like a grade 2 hamstring muscle strain. So now that I've figured out or isolated what muscles involved, the next part of this is really going to be manual muscle testing. So I'm going to do it on the good side so you can see what that's going to feel like and what I want you to do. And then we'll move to the injured side so you can see what that should feel like as well. Are you ready for that patient?
I am ready.
Okay.
It will be lackluster performance, I'll tell you what.
Okay, so in the next part of the assessment, what we're going to do is really test the strength of the muscle, because that oftentimes will tell us how intact or how strained it is. So what we're going to do is have the patient's foot right here straight. And what I want that patient to do, or what I want you to do, is pull your heel to your butt, if you don't mind. Come on up, come on up, come on up. Now, let's be honest, he's probably stronger than me. He's being modest here. So go ahead and hold, don't let me pull you down, okay? That will test the entire hamstring muscle group, but if we actually want to isolate the hamstrings, right, and see which one is actually involved, we'll kind of turn the foot outward to look at that outside biceps femoris muscle. So come on up and hold, don't let me pull you down. Great, and then we're gonna do the same thing with what we call as an internally rotated foot to look at those internal muscles or those medial muscles. So come on up, pull, 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 and don't let me pull you down, okay? So now that we've done this, we have an idea of how strong our patient should be. We're gonna move to the injured side. And since this is an injured side, and since I think he probably has a grade 2 muscle strain, one of the things we have to consider is, do we want to create pain in our patient who we already know is painful with palpation? And so what we usually do before we start the manual muscle test is really just have the patient move their foot to their butt. So go ahead and move your foot to your butt. And if the patient is struggling to do that motion, then there isn't a reason to do the actual manual muscle test. That's perfect.
That's as far as I can go.
Okay, how much pain are you in when you do that? Scale of 1 to 10.
Like a 4, 3.
Like a 3 or 4, that's not bad.
Maybe a little lower than
you have a high pain tolerance. All right, so what I'm gonna do now is literally just put a finger on the patient, and I want you just to contract your muscle. And what I wanna do is really palpate that area that was the really truly the focal point for pain. So come on up. And what I'm looking for is, does it become more deformed as he moves through that process? And yeah, we can kind of sense or feel the deformity right in here. And we have a little bit of what we would call as a muscle rollback from the proximal and distal fibers of that biceps femoris hamstring. All right, so what I have in my hand is a real-time ultrasound. This is not your typical ultrasound machine that most of us would associate with pregnancy. These ultrasounds can certainly be used in the stages of pregnancy, but what we're using the real-time ultrasound for right now is what we call musculoskeletal assessment. This allows us to kind of have a live look into the patient's tissues before we refer them out either for an MRI or an X-ray. So this is a quick look. The gold standard, however, in this particular injury is always going to be an MRI, but this is I think a great clinical tool to use to get really quick feedback. All right, so what I wanted to do was use the real-time ultrasound to help confirm the diagnosis of hamstring strain. This is not your traditional OBGYN ultrasound, but certainly can be used for that. This is an MSK or a musculoskeletal ultrasound, most often used to visualize abnormalities in certain anatomical structures. So in this particular case, we're going to be looking at the hamstring muscle. We'll be using the ultrasound to scan both distally and proximally on the biceps femoris muscle in particular, because that's where my eval told me the pathology actually occurred. When we look at real-time ultrasound, there's really 2 key components that we're looking for: something that's hyperechoic, which is really bright and white-like on the film, and then we look for things that are hypoechoic, which means they're more dark or gray tone. And so when we see something that's dark, within a muscle belly. Most often that is a sign and symptom of fluid in the injured area. We see tissue that's disrupted or broken or maybe even jagged, for lack of better words. Most often that's associated with some sort of rupturing or straining to the actual fibers. So I'm doing is really going to the area of palpation with my ultrasound probe here to just look at whether or not we have an intact tissue structure, and then whether or not we have swelling within that injured structure as well. And so as we're looking at this real-time ultrasound, one of the things that's very evident in this particular patient is there is a lot of fluid at the proximal attachment site of the biceps femoris, and that's very clear in the hypoechoic regions that I see within the actual hamstring muscle itself. So this again confirms the diagnosis of a grade 2. The reason I don't suspect a grade 3 or a complete rupturing is because all of the fibers still look intact when I compare it to both the semitendinosus over here and the semimembranosus tendons. It looks like when I scan over, at least the tendons are intact, but we have swelling in this particular area of the ultrasound, creating some concern for a grade 2 hamstring strain. So celebrate, I guess, that we don't have a complete rupture, yet we have a little bit of a road to recovery. When we think about hamstring injuries in general, they are muscle. In this particular patient's case, one of the things that we've seen is that he has a high hamstring strain, right? What we know about hamstring muscles is that more proximal and distal muscles become tendinous in nature. And so when you injure the tendon component of an anatomical structure, they take a little bit longer to heal because there's a lack of blood flow to that particular area, right? So in this instance, we would typically say if the injury occurred in the actual muscle belly or in the meat of the muscle, we're looking at 2 to 4 weeks recovery. But because we have a tendinous pathology, more like 4 to 6 weeks for a full, complete recovery, which honestly meets the goal for the February deadline. Isn't that right?
Yeah, that's not so bad.
Woohoo, YouTubers, we are celebrating.
So what would you recommend, like, in the meantime that he do as part of his like a rehab kind of protocol?
So the first thing that I would recommend, and the goal of any recovery after an injury, is to reduce the swelling. Because he does have a significant amount of swelling within the actual tissue, some of the things that we want to do are going to be icing the injured area as long as there are no contraindications for the patient to icing. Want to wrap the injured area because wrapping creates compression, which allows the lymph system to kind of recirculate that swelling. We're at day what of the injury?
Saturday. 3 days?
Okay, so we're at about 72 hours post-injury. So we can start doing what we call as a very soft tissue, like or an effleurage, to help reduce the swelling or push the swelling out of the area. The key thing is going to be reducing the swelling and the pain. After we reduce the swelling or the pain, the one thing we know about this patient is they're strong, right? So strength isn't what we have to regain. What we have to do, the goal for me, I think if this were my true patient, would be to reduce the pain, to reduce the swelling. The strength will come naturally to this patient. But one of the things that I probably would start doing once we've reduced the pain and the swelling and the patient's strength has returned back to normal is to start eccentric loading of the hamstring muscle group. And he'll work with Dr. Jacob Gooden to restore that eccentric strength.
Like,
Get Dr. Gooden on that one.
Like, so something that I've heard was like with the eccentric, or so we call it like tempo training, which is like the slow eccentric.
Yeah.
That it trains more of like the tendon as opposed to like the well, it still trains the muscle, but the
it
tendon.
gets at the distal and
Yeah.
proximal components of most muscles. The other thing is like, so like when we think about the muscle, it's going to be strongest. Well, they say it's strongest in its concentric phase, right? Where
Yeah.
it's shortened, which makes sense. And we think about most people that are working on strength gains, they're totally doing concentric stuff, right?
Yeah.
But then when we think about like where, like if you look at the lengthening component of that, I always tell our athletic training students that the lengthening component is just as important because
Yeah.
the eccentric, so like here's hamstring, right? You're going to do this well because that's what you train to do. But imagine being able to slow down something. Well, the hamstrings do that. They slow down the rate at which we move into a knee extension moment. So yes, eccentric training will help with the more distal, weaker components. But more importantly, what it does is it counteracts the concentric phase, because when you go into the concentric phase, you have to be able to come out of that controlled at some point in time. That's way key in weightlifting, right? You're gonna go down, you're gonna load, and then you're gonna come up, however that might be. Not a weightlifting expert, YouTubers, but you get my point. There's an up-down phase, right? The down phase, the quads are gonna be eccentric loading. The up phase, those hamstrings are gonna be crazy stretch.
And we don't train the eccentric, like, because for our sport, it's the deadlift.
Yeah.
And
show me the deadlift though. I wanna see.
well, so with the deadlift, you start in the concentric portion, so you lift, and you don't necessarily control it on the way down. You just kind of let it fall.
down.
Yeah,
So we don't, unless you're doing some sort of tempo work, we don't really focus on any eccentric loadings to the hamstring.
More crazy gopher time with emerging strategies. So
Oh.
ironically, I was doing a bunch of 6-0-0 tempo conventional work before this injury. That was my peaking block, actually, was tempo focused eccentric loading with crazy gopher under Mike Teixeira. So I wonder how much worse this would have been if I hadn't been strengthening that in the first place. I've worked with Mike Teixeira already, and one of the strategies that he has used in emerging strategies, crazy gopher, is an eccentric loading focused phase of training. And I found that I actually responded best. I had implemented that for all of my squat work and my deadlift accessories in this last training cycle. And so I'll continue to do that as recover, which will work out well. If I can get myself back to 100%, that was going to be the peaking protocol again, because everything up to this point in the meet for the injury had been amazing. And so be interesting to test that and see how that impacts hamstring recovery going forward.
I believe Dr. Ryan Noakes, who is the clinical coordinator for the Masters of Science in Athletic Training, will be working with you in the recovery phase. That is his area of expertise. I'm an expert mostly in patient evaluation. So the next video segment that you will see will be with Dr. Noakes creating, I think, a 4-week rehabilitation plan for you.
So, well, thank you so much.
You
Appreciate it.
welcome.
All right, well, Dr. Cosby did a great job. Obviously, learned a lot about human anatomy and know more about my hamstrings, and that there's like more than one part of them. So we're going to look into what sort of rehab protocols I need to take. She told me off camera, it's like, this is like a 2, but it's like kind of like a 2+. So almost ripped the whole thing off, which would have been really bad, require surgery. But right now I'm still, it seems like, in a pretty good state. We'll find out over the next probably 4 weeks just what it looks like. But still on a good timeline to hopefully gain some strength back, hopefully come back stronger and learn some things for my training going forward to minimize the chance of injury. Kristen, what stood out to you from her comments?
Well, I actually thought it was really interesting just to, you talk about a strain and a level 1, 2, or 3. And so being able to physically see what that would look like on an ultrasound was actually really cool.
For sure. All right, well, let's figure out what I got to do now.
Greatness lives inside all of us. EvolveAI uses evidence-based research and innovative artificial intelligence to optimize your workouts so you can get results faster. EvolveAI. Unlock your potential.